Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 10 additional deaths due to COVID-19. This includes a male in his 50s from Southern Health Santé Sud, linked to the outbreak at Bethesda Regional Health Centre, a male in his 70s from Winnipeg region, a female in her 70s from Interlake Eastern region, a male in his 80s from the Winnipeg region linked to the outbreak at Maples long-term care home, a female in her 80s from Southern Health Santé Sud linked to the outbreak at Mino Home in Grunthal, a male in his 90s from Southern Health Santé Sud linked to the outbreak at Mino Home in Grunthal, a female in her 90s from Winnipeg region linked to the outbreak at Maples long-term care home, a male in his 90s from Winnipeg region and linked to the outbreak at Bridgewater Senior Living of Tuxedo, a male in his 90s from Winnipeg region, and a male in his 90s from the Winnipeg region. These are 10 more Manitobans lost, and I extend my condolences to their family and loved ones. There have been 185 deaths due to COVID-19 in a month of November alone. 70% of our total COVID-related deaths have occurred in the month of November. This compares to 60 deaths in the month of October. And so we continue to reiterate these deaths are much more than numbers. These are loved ones who are sorely missed right now. And we know we can't continue with these numbers. We can't continue with these daily case counts. We can't continue to list off this many Manitobans lost daily. Our current 5-day COVID-19 test positivity rate is 14.8% provincially, as well as in Winnipeg. 383 new cases of the virus have been identified. 2 cases were removed due to data correction. And 1 case was from out of province, so we have 381 the total number of lab to report, with a total of 15,288. Our messaging remains the same, and that's to stay home. Stay home as much as possible, leaving only for essential reasons. When you do leave, send the minimum amount of people from the household to achieve those essential purposes. And when out, practice the fundamentals: hand washing, wearing a mask, physical distancing, and staying home, and only out for the essentials. It includes avoiding things like non-essential travel, and that's non-essential travel outside the province for shopping. We're going to avoid that at this point. We encourage people to buy local, buy online, buy on the phone, use a curbside pickup. Try calling stores to see if they can be of assistance for non-essential items that you would like to purchase at the curbside. We know that first and foremost we have to avoid gatherings, to avoid any gatherings outside of our own household, and that may be, it certainly includes faith-based services in person or other type of gatherings. Employers, we need to continue to support your employees from working at home as much as possible. If it's not feasible in that sector, then to ensure any measures are in place that reduce crowding, mask use, hand hygiene, screening, as well as supporting employees to stay home when ill or stay home when required to self-isolate. We talked about self-isolation and what that means. It's one of our best tools to minimize the transmission of this virus. Very thorough case identification and isolation and contact identification and isolation is what we rely on to be able to keep any parts of our economy moving. So to self-isolate, that really means from everyone. People who are self-isolating, who are listed as contacts, should they become a case, really should have no contacts. There really should not be any chance of passing that virus to others. That's the purpose of self-isolation. Now, of course, we understand in some households, self-isolating from all others is difficult or impossible in some circumstances. But for many, it's very feasible to self-isolate at home. It's very feasible to go to an alternate isolation accommodation if necessary. And those who are unable can minimize their risk. Have only one person as a contact in that household to the person who's self-isolating if necessary. Minimize the duration of contact, wearing masks, hand hygiene. So there's a lot of things we can do. We need to be able to rely on our public health methods to reduce the transmission of this virus. So we rely on Manitobans to self-isolate appropriately when advised to do so. Our healthcare system is being pushed to its capacity. Our healthcare providers are overwhelmed. So we need to change the transmission that we're seeing right now. We need to bring these numbers down, and then the safest way, like we say, is to reduce the amount of contacts you have. And the best way to do that is to stay home as much as possible, out only for those essentials. Follow public health advice, self-isolate appropriately when advised to. We're definitely all in this together, and we can make a big change if we all work together. So thanks, and we can open up to questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CTV, Michelle.
Hi, I'm wondering, with the number of recovered, have you started using that automated outbound calling system, and is it helping?
That's just going to be rolling out this week, I believe, so we haven't had that up to date as yet. So I can say our active case, our proxy indicator for that, again, 10 days post swab date and not hospitalized, that active case proxy is 3,251 right now.
Okay. Sorry. What does the closure of the hospital in Grandview, so staff can be redeployed to the community's personal care homes, say about the COVID-19 situation in that part of the province?
Yeah, so I don't have a lot of details on that. From my understanding, it was the temporary closure there was necessary just to redeploy some staff due to some pressing needs. And so we can probably further update that tomorrow.
From City News, Jonas.
Good afternoon, Dr. Roussin. Looking at the data here from yesterday, and I noticed the number of tests was down quite a bit. Test positive rate from yesterday up around, I think, 25%. Couple questions on this. One, I guess, why was the testing numbers lower yesterday? And two, is there any focus testing or anything that would, I guess, give us any solace in this number from yesterday?
Yeah, I think a lot of this was related to a couple timing issues with the labs being entered into our system. So this is probably going to be reconciled today, and we'll have that updated tomorrow. But no, there wasn't any specific testing programs that were going on that I was aware of that would lead to this.
I guess as a follow-up, sir, this number from yesterday, I mean, we're, 10 days or so into this second, for Winnipeg, or, this week for the province. I guess, what does this number tell you?
Well, I mean, it's still a little bit early to fully understand what the newest restrictions are, what effects they're going to have. As we mentioned yesterday, some of our modeling numbers from before entering into the red showed us that we were expecting to be much higher than where we are right now. So that's having some effect. But certainly, to be clear, this is not where we want to be. We need these numbers to come down, and we'll still be expecting that based on these restrictions. So we'll have to be watching these numbers very closely over this weekend and early next week.
From CHVN, Taylor.
Hi, good afternoon. We're seeing a lot of community transmission, but are you concerned about the rising case numbers in the unsheltered population?
Yes, that's been a concern, especially in these sort of underserved populations. We've seen a disproportionate effect, and of course the public health restrictions that we have in place don't provide the same level of benefit for people who are underhoused or living in poverty or near poverty. So we've put a number of things in place. We're increasing opportunities for testing in the area, including looking at rapid testing. We've expanded our alternate isolation accommodations in the area, so we are trying to respond to that demand.
From a public health standpoint, what's the best way for those people who are experiencing homelessness, whether it's chronic or otherwise, to take care of themselves right now?
Well, this is a challenge. At all times, we know that income is a major determinant of health, and so this is something that public health is aware of and tries to deal with as best we can. And so right now we've, like I said, we've tried to get a number of these things in place, these alternate isolation accommodations. We're working on what sort of other measures we can put in place to target, to further support this population. And so hopefully we'll have more to come on that.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon, Dr. Roussin. We heard yesterday about a COVID suspect observation unit being open in the emergency department at HSC. What can you tell us about, I guess, people who are showing up at the ERs in Winnipeg with COVID concerns? Are we seeing people attending with, maybe more severe outcomes?
Well, it's varied. I don't have a lot of details on what the presentations are like there. So we know that there's a range of symptoms with COVID, from asymptomatic to very mild to very severe respiratory distress. And so there's a range of what we see presenting to primary care and to as well as to ER. So I don't really have a lot of details on that.
Okay, thanks. So before, I guess, public health can look at rolling back some of the restrictions that are in place today, what kind of capacity needs to be added to the test, trace, and isolate system? Are we planning to ramp up testing, promote people to go get tested before we can, roll back these restrictions? Or what needs to be done to make sure that system is prepared when we roll back these restrictions?
Yeah, so it's multiple things, right? So one is we can't think about lifting restrictions with these numbers. So first and foremost, we need to see the test positivity coming down. We need to see our absolute case numbers coming down. And then we need to see that translate into a reduction on the strain on the healthcare system. And then at the same time, we're working on expanding our case and contact investigation because as we roll things out, as we open restrictions, we know that will result in increased amount of cases. And so what we want to have is a very robust capacity to detect cases, to have them isolated appropriately, and to find all those contacts in very short order and have them isolating appropriately. So, so there's a number of things moving at the same time. Our testing, our access to rapid testing is just one of them.
From Global, Will.
Good afternoon, Doctor. Our eastern neighbor, Ontario, has released some big new case numbers recently, sometimes in excess of 1,000 new infections. I'm wondering if reports like that are ever reflected in our numbers, which is to say, I guess, is travel having any sort of an impact on our local case count?
Yeah, still, right now, travel is not making up a significant proportion of our cases. In this second wave, our cases have been community-based transmission in various settings. You know, early on, it was more predictable in the gathering settings there, where we saw in restaurants, bars, and of the such. Now it's widespread community-based transmission, but not seeing a lot of travel-related cases at this point.
Okay, thank you for that. Also, are we any closer to knowing details about a vaccine rollout here in Manitoba in terms of maybe doses, dates, who's going to receive it first, that sort of thing? What do we know?
Yeah, not specifics. Certainly, there's a lot of work being done at national level, and then right here to roll out those plans. So it's challenging because we just don't have the exact details yet, but we're planning for a bunch of scenarios, right? Because we need to be ready for when this comes. So, we're planning to receive vaccine in the early new year. Whether that actually occurs or not is something different, but we have to be ready to do that. It will no doubt be in relatively small quantities. And so we are working on here and at the national level on those priority groups you mentioned. And so we don't really have details to share right now because we don't necessarily know the specifics of the quantities that we're going to receive, but we'll continue to update Manitobans as we know more.
From the Brandon Sun, Colin.
Hi, Dr. Roussin. We've been told by the executive director of the Rotary Villas Assisted Living Facility here in Brandon that Prairie Mountain Health home care workers that work at Rotary Villas are also being seconded to work at Fairview Personal Care Home, which is under a COVID outbreak. I'm just wondering why that's being allowed, given that workers working at multiple facilities like that have been identified as a potential way for COVID to spread.
Yeah. So we've been receiving a lot of questions and concerns about that. From my understanding right now, that plan is currently under review. It hasn't been implemented at this point, so they're still reviewing other options.
Okay. Can you provide any sort of update on the outbreaks that are currently going on in Prairie Mountain Health, like at Fairview Personal Care Home, Reston School, or the Grandview Personal Care Home?
I don't have a bunch of detail on those. We can certainly get the updates there. I know the Reston School, I believe, has 5 active cases and are set to, I believe, return in the upcoming week if all stays this way.
From CJOB, Clay.
Good afternoon, Dr. Roussin. Has there been any indication that any other Manitoba school division might go to code red, as was the case last week with the Hanover School Division?
We don't have any specifics right now. Those are the type of things we review really daily as the numbers come in. And so we'll watch the trends in different areas, but I can't speak to any specific school divisions or areas that we're right now contemplating going to that red restricted for schools.
Okay, quick follow-up. We are hearing that the Church of God outside of Steinerbeck is planning another service this Sunday, despite the fines that have been handed out. Do you have any comment on that?
Well, I think the comment is just to everyone who's planning on gathering. Right now our test positivity rate is very high. In that particular region, the test positivity rate is even higher. So to gather with a lot of people, there's a very high probability that at least one person in there is infectious. And when you're gathering indoors for a prolonged period of time, then it's very likely that infection will spread. And so all of these orders, all of this advice is to protect Manitobans, to protect our healthcare workers. And so working around those orders does the opposite. You put our healthcare workers at risk and you put Manitobans at risk. So my advice is, follow our advice. It's well articulated that it's difficult, but the balance is our healthcare system is under strain, our healthcare workers are exhausted, and so we need to all chip in right now as Manitobans and not gather.
From the Winnipeg Sun, Scott.
Good afternoon, Doctor. Scott Bill from Winnipeg Sun. Just a question, kind of piggybacking off of Clay's there. What is the next step for enforcement with that church, assuming they do gather on Sunday? They've already been fined. I think one of the ministers there was also given an individual fine as well. What is the next step for enforcement for a place that it continually flouts the rules?
Yeah, well, I won't speak specifically to that area to that organization on what we would do with enforcement, because it largely depends. Overall, public health has a number of options. So there's a health hazard order if somebody was undertaking activity that we felt put the health of the public at risk. We could issue a health hazard order that would require a organization to close. There could be continued fines. There could be prosecution under the Public Health Act. So those are just the various options available to enforce things.
Thanks for that. And we're getting a lot of questions over the last several weeks about the PCR test and how many cycles Manitoba or how many cycles we do here compared to other jurisdictions, and if we're doing too many cycles or the test is too sensitive. Can you kind of explain how the cycles work and why we would have ours potentially higher than on other jurisdictions, maybe some that are in Europe and that sort of thing?
So remember that the PCR technology is used in multiple lab tests. So it's not unique to COVID. We used PCR tests for decades. So there's many lab tests that we use to identify microorganisms under PCR. So it's not a new technology. And these are the things we've dealt with for decades with this type of testing. And so for us, we don't just have so the PCR, again, it's looking for genetic remnants of the virus, and those remnants are picked up and doubled and doubled and doubled until detected. And so the more times it takes to double, then the less you've detected. And so we look at all these things. When we have a high number of cycles on a certain test, and then we review it clinically. If this person was symptomatic maybe weeks ago, we may not consider them infectious right now. If they were without symptoms and a very high CT, we call it a cycle, that we may not consider that a case. So all of this, tests don't diagnose individuals. Healthcare providers diagnose individuals. Tests guide us in our decision. And so this is just one of the methods we use to diagnose COVID right now.
From CBC Radio Canada, Gavin.
Hi, Dr. Roussin. We heard yesterday evening that N95 masks are not available for nurses in 5 care homes in Southern Health, 4 of which have COVID-19 outbreaks. And the problem seems to be, according to the care homes, that fitting has not yet been done for N95 masks, which to me sounds like they weren't prepared. How concerning is this situation for you?
Well, I can't speak specifically or comment on that. I don't know the details of what is happening there. So I would say is that we're well into the pandemic, well into the second wave. So preparation is important. So I hope that anyone who wasn't prepared is taking measures to get so. But I can't speak specifically to those issues.
We're hearing that multiple school divisions are having their division staff work from the division office and not from home, and it seems to be common among school divisions to do this. How do you feel about public organizations like this not arranging for their staff to work from home?
My message is a broad one. It's not specific to any organization. It's if you can achieve what you need to by having staff work at home, then you should strongly consider that. I don't know the situation in those organizations, so that might be a better question to direct towards education to answer. But my message is the more people we can get at home, the better. Essential purposes, yes, we need, and that that is employment in a lot of instances. So if it can work from home, then I strongly suggest you do it. It might not be able to work for everyone.
From CBC Manitoba, Bart.
Hey, Dr. Roussin, we are hearing about employees in many wings of the provincial government and nonprofit organizations that work in health-related professions being seconded and moved into COVID response. Justice officials doing contact tracing, potentially also people who work for nonprofits in health being moved over. They haven't been told what they're doing yet. Will some of these people be doing contact tracing case investigations? And if so, how can they replace a trained public health nurse?
Yeah, and so no one's going to be put in a position to be performing work that's outside of their scope or abilities. So there's a lot of steps taken and say for contact tracing, calling up cases, following a script to see how they're doing, notifying contacts. In some cases, depending on the level of training, then case investigations. But yeah, it's there's just a lot of roles to be played, and we're with these increasing cases, we need to increase our capacity, but we're not going to do so in an unsafe manner. No one's going to be taking on roles that they're not equipped to do.
Thanks for that. It was confirmed from Shared Health today they're opening a second COVID unit for mental health patients at Selfisolation Mental Health Center. It's in the same building with psychogeriatric patients. We've seen at Bethesda what happens when you've got the same workers going between. How concerned are you about the institution of a COVID unit at a hospital that doesn't have any COVID cases yet?
It all comes down to the way it is implemented. We have a lot of safety mechanisms in place. So there's a lot of infection prevention and control policies that need to be ensured they're being followed. Strict adherence to PPE guidelines. Strict adherence to all of these safety protocols, and really, when those are in place, then we've dramatically reduced the risk. So, I don't have specific information on on Selkirk what you bring up there, but it really depends on the strict adherence to the policies that are in place.
From the Canadian Press, Kelly.
Hello, Kelly with the Canadian Press. You mentioned that right now we're seeing more community spread and in not travel-related cases, but with the holiday season and people looking to travel to see families upcoming, are you considering implementing out-of-province travel restrictions again, especially when we look to Alberta, Saskatchewan, and even Ontario, and a drastic increase in cases there?
So, I think the answer is probably always that we never take things off the table, for these type of things. If you look at the community transmission and our incidents here, we're not that different than many of these other provinces. So, in that way, restricting travel between the provinces doesn't grant us a lot of benefit. In saying that, the message is clear. Is that really the non-essential travel shouldn't be taking place right now, and that includes travel for the holidays. This is not going to be a normal holiday season. My advice is people to, for the most part, stay put. Don't travel, even within Canada. Don't travel non-essentially even within Manitoba. We have to prepare to celebrate this year with our household members, with few exceptions.
And hospitalizations usually follow infections by a week to 10 days. These numbers are remaining high every day. So how worried are you for upcoming hospital capacity, even if the numbers stay steady or begin to drop slightly?
Yeah, and so these numbers are numbers that we can't sustain, certainly not in the long term. And we do see that 7 to 10 day lag, and right now we're seeing about that 4% admission rate and 1 to 2% ICU admission rate. So we can all do the math. When you have that 400 case day, we know with relatively with pretty good predictability that 7 to 10 days later, that's how many people we're going to see admitted to hospital. So we can't sustain this in the long term. That's why we're saying we need these numbers down, because our healthcare system is being stretched.
From the Globe and Mail, Carrie.
Hi, thanks for taking my question, Doctor. I'm wondering if you can explain a little bit more of how many hospitals are on the brink in the way, like Grandview had to close, and where ERs are triaging in parking lots.
Yeah, I don't have up-to-date information on that. Lynette will probably be able to provide a bit more of an update on that. I'm not aware of any other facilities that are, considering the closing at this point. I don't have any specific reports of triaging outside of the normal procedure. But nonetheless, we know we've had to disrupt many elective procedures in order to get the capacity we have. We still have more capacity to go, but again, it's going to be at the cost of something else. Everything we expand now has to come from someplace else in the system, and so we really need to get these numbers down.
And then building on that, what's the one thing that maybe you're seeing in the hospital facilities now that you never thought you'd see?
I don't think there is, other than just the sheer numbers that we've, unfortunately were, preparing for in the first wave. It's really just the sheer numbers of it. I think that when we saw some transmission within hospitals, I think that we had a lot of protocols in place to try to really minimize that, but it's quite difficult to stop the transmission of this virus. But we saw that some of the outbreaks within acute care facilities put that added strain on staff, because now we have staff off self-isolating. So there's been a lot of strains in one way or another in the healthcare system this second wave.
We have time for a few more questions this afternoon. Please proceed.
Dr. Roussin, when are you going to ramp up that Steinerbeck area testing capacity? We ask every day.
Yeah, I believe it's being worked on. I don't have any updates on it, but it's definitely something that needs to get done. We're testing capabilities. In most of the southern region, we have a lot of testing capability that's not being even utilized. But in Steinerbeck, we definitely want to increase the site capacity.
Do you have an update on
Picking up on that, I
the
wanted
test
to know about
positivity
the
rate?
number of tests. On the number of tests done per day, we haven't really reached our capacity for swab sites for some time. Are you concerned about that there isn't enough people being tested for COVID right now?
When you see a test positivity of 14%, and higher in other places, then that's always a concern. Is that we're not picking up on other cases. Now we know at any test positivity rate, there's always more actual transmission than what we pick up on our tests. With our hospitalization rates and ICU hospitalization rates, it doesn't appear that there's a tremendous amount of activity out there that we're not picking up on, or, because like we say, 7 to 10 days, we would expect a proportion of those people in hospital. And right now we're seeing the relatively, expected proportion from our diagnosed cases in hospital right now. So, the message is clear. We want people to stay home. If you have symptoms, we want you to get tested as soon as possible and self-isolate pending results. It's important to get tested because that's what triggers our contact investigation.
Dr. Roussin, do you have that Steinerbeck test positivity rate yet?
Yeah, we're following that. It's still hovering around that 40%. It's a lot of variability. I believe yesterday when I looked at it, it was in the high 30s.
Dr. Roussin, can you tell us the number of cases in the past week or so that can't be epi-linked?
I think that's been a significant proportion for us. I'm not sure if we have. I think since we've been working on our contact tracing capacity, we hadn't kept that indicator in. But from what I can tell you is it's still roughly around half. Roughly around half of our cases we can't link directly to a known transmission chain.
Would that be 50% then, community transmission? Is that what you would?
That's what we would describe that as, yeah.
Okay. Just one question about no, never mind. Brain fart.
Dr. Roussin, going forward, is there any plans from public health to perhaps better support or enforce that people will follow self-isolation rules? It's been pretty voluntary, I think, with periodic check-ins by public health when folks are supposed to be in that isolation period. Is there any plans to increase that surveillance?
I think that our plan is that these restrictions are going to bring some of these numbers down, and that we're going to be able to loosen the restrictions. And then to keep those restrictions loosening or not at a level like this, we really want to have a very robust and urgent case and contact investigations with self-isolation. So yes, I think we're going to really be in a spot to urgently investigate all of these, as well as support, but also enforce the requirements for self-isolation. It's if we want any chance of being able to keep our economy moving, we have to offset it with very urgent and very effective case and contact investigations.
Dr. Roussin, do you believe it'd be dangerous to release more statistics to Manitobans regarding, let's say, sources of transmission, such as how Saskatchewan's done it, breaking it down between religious events, retail outlets, restaurants, all that stuff? Do you think that information would be dangerous to Manitobans to have that information?
I don't think it would be dangerous. I think it's something that we intend to do. We've done in the past. I think it's a challenge. Like when you start talking about where you acquired a virus from is different. So we'll have somebody who is sick, and then we'll look whatever that days to a week to 2 weeks before on what type of activities they're doing. Often we can't link them directly to a transmission chain, but we know they may have spent a lot of time at restaurants or at a bar or in a workplace, and so sometimes the accuracy of that is challenging. But what you'll see from those numbers is that there just isn't a one place that contributes to the transmission of the virus, and that's what's unfortunate about not being able to take just targeted approaches. You'll see that a certain proportion takes place at faith-based organizations, certain proportion at restaurants, certain proportion at bars, certain proportion at gyms. And so we can't really take a specific targeted approach because transmission is just widespread, and we know it. This virus transmits with prolonged indoor close contact.
Thank you, Doctor. This concludes today's media briefing.